Yes, thank you, Livonia. So we're going to go ahead and get started with Susan. We're going to kind of jump right into this because we want to have a lot of discussion. And the topic today is early warning systems. Susan, I'm sure you can give us just even a small, brief historical thing, but it seems to me that this kind of started out of Johns Hopkins University with Ball Balfont, really focusing on just how many school dropouts we had and how they were being concentrated in certain areas, and that if we could come up with an early warning system, we could figure out how to not only identify those individuals, but start coming up with some specific programs and activities. And it seems like this has been a really exciting area. I know that the American Institutes of Research has been a leader in this whole area and has certainly helped design the work that we have in Massachusetts. But maybe to start us off, and I know you've got some slides to help us look at it, but kind of give us that overview of what an early warning system is. What, where are we with the research, and what your and even some of your thoughts as we start moving forward as from the research perspective.
Sure. Thank you so much, Scott. And it's really exciting to be able to present and use this format to be able to interact with folks. So I'm really appreciative. So just generally, what is an early warning system? So I think it really started taking shape, Scott, you're right, with seminal research from Johns Hopkins, as well as the Chicago Consortium for Chicago School Research, identifying some pretty simple early warning indicators in ninth grades that could identify, and in middle grades, to identify schools who are at risk of not graduating from high school. So based on those indicators, this concept of an early warning system was born. And an early warning system really relies on readily available data that's housed at the school level. And being housed at the school level is very important because the educators and adults in the system who interact with students are the ones who will be providing them with direct support. They need this information to be able to make decisions about students. And an early warning system relies on early warning indicators, and I think that distinction is really important because there is a difference between indicators and the system as a whole, and I'll go through that in a moment. The indicators will predict which students are at risk of missing a key educational milestone. So this started with identifying students at risk of dropping out or not graduating from high school, and actually the concept has expanded quite a bit since then to identify students who are at risk of missing other key milestones, such as reading by the end of third grade in Massachusetts, or even the likelihood of enrolling and persisting in college. An early warning system is used as a system to target resources to support off-track students early. So this early diagnosis is really important. It's a lot easier to intervene early than it is when, for example, a student's already left school. It allows you to implement a systemic and routine set of strategies for identifying using the early warning indicators, diagnosing using supplemental information, and supporting and monitoring at-risk students. And at the school and district levels and even state levels, it allows stakeholders to examine patterns and identify specific school and district issues and needs to ensure that the appropriate supports and resources are being provided to those most at risk.
Great.
So do you want me to move on, or?
Nope. Yeah, please.
Okay. So really, in collaboration with Massachusetts and other states, with our work with other states and districts, we developed what we call a theory of action. So the theory of action for early warning systems is that it's grounded in research because the indicators and thresholds have to be validated to make sure that they're appropriately identifying students and really not missing students who might be at risk. We want to ensure that it's not another label or accountability measure. You're going to hear me use the word action many times in my conversation. The idea is not to put another label on students, and I tell people if they're not going to take action or not equipped to take action or prepared to do that to support students, don't bother with even the early warning indicators. And then one key element to being actionable is that the outcome measure has to be meaningful to adults in the system. It has to be able to be something that an adult in the system is equipped to support a student with. So for example, in another state, there was a they were identifying kindergartners who were at risk of not graduating from high school. When you think about, not in a state, it's actually in a district, but when you think about that, what were kindergarten or first grade or second grade teachers going to do with that information? They're not trained to support a student necessarily to be equipped to graduate for high school, though granted what they're doing is building on those milestones, but rather so when we're thinking about that, a more appropriate outcome might be reading by the end of third grade, which we know is a really critical outcome, and also one in which the adults in the system in the earlier grades are trained to support students to reach those outcomes. So the idea of early warning systems really took off in 2008 after the U.S. Department of Education Institute for Education Sciences put out a dropout prevention research guide, which identified early warning indicators as a diagnostic to identify students early. Also identified some targeted interventions and school-wide interventions. And really, early warning systems as a system transcends all of these ideas that were identified as promising practices in the dropout prevention research guide. So since we've been working with states and districts and schools throughout the nation, we started to try to encapsulate how you go about thinking through this work. So the first key step is synthesizing research on early warning indicators. That has largely been done by many organizations and is readily available to many of you. I've included some resources at the end of this my presentation. The next is to validate indicators. And those are the early warning indicators to make sure you're appropriately, like I said, identifying students. And then customizing and developing tools and supports to make it easy for people to make decisions about what students need and provide them with supports, and then start to implement, and then, of course, a continuous improvement process. So when we go through synthesizing and when we talk about synthesizing the research and validating indicators can require a capacity that not all districts and schools possess. So what we suggest is that using the research-based indicators from other studies might be a good place to start. And so this is a list of potential indicators for middle grades and high schools and the thresholds at which you would be identifying the students as at risk for high school graduation. But another thing, I know there was a question about the use of social emotional learning or SEL indicators within a early warning system. And I do think that's an interesting idea, but would need to be validated. In order to validate an indicator, you need several years of data, and you need to be able to do some analyses to identify where those cut points are where you would be identifying students. But there are other options in places where you could be using SEL information to actually inform the types of interventions. And that's a really key point here. An early warning indicator is really a symptom of risk. It is not a diagnosis of need. And as you can see in this, in the seven-step early warning intervention monitoring system that we developed through the National High School Center and that we've used in several other studies subsequently, there's really a point here between step 3, which is reviewing the early warning system data or early warning system indicators. That's identifying students based on the symptoms. And then step 4, which is interpreting and diagnose, and step 5, diagnosing and identifying which supports are needed. So what's really important to know about the early warning indicators is that it's so critical to keep that point simple. What you're trying to do at that point is say, okay, this person, for example, I'm taking their temperature, they have a fever, let's move to the next level. Instead of let's move to the next level with everyone without kind of discerning how we're going to use our resources efficiently. So this student has missed 20% or more of school days. There's something going on here. Let's take this student to the next level and review, interpret what's going on with this early warning system data by diagnosing and using additional information, for example, SEL information or other types of information to make a really to use our judgment and make a good decision about how to move to step 5, assigning and providing an intervention. And then, of course, also critical to this is monitoring them in their interventions and making sure this process is continually improved. That's a key, the assigning of the intervention and the monitoring is a key step. It's a very challenging step for educators when they're implementing these systems, and typically takes a little more effort initially, but can get a lot more streamlined over time as everyone gets used to making these decisions, monitoring students, and moving through it over time. That was my brief introduction to early learning systems.
No, I appreciate it. And so just to kind of summarize then, the way you're looking at the early warning system, and it's important because we have to be efficient in how we use our resources. So it's a method to identify who has needs, right? Who would be at risk. But it's not telling us yet why they're at risk. And so there's that part that you had to think in step 5, which is probably a pretty loaded step in terms of trying to assess why it is that this person may be in at risk and what we can do to try to support them. And I think after we get done with the other presentations, we'll probably be looping back to some of those kinds of questions as well. But it is important to be able to identify, because we don't have time to figure out individually who's at risk. So this at least gives us kind of a barometer to gather some of those individuals together. So, and I think now, go ahead.
And I just add one more piece to that. The other important piece is that these data are housed at the school level where educators can access them with frequency. So things like attendance are kept at the school level. You can look at that over time and not just one time in the year. So you can start to see shifts and changes. So, a student in quarter 1 may have fine attendance, but by quarter 3 has missed 20% of school days. You'd flag them and you'd be able to intervene early.
That's great. That's great. Okay. So I think we're going to move on now into kind of seeing what this is like at a state level. So obviously what you described at the national level in terms of doing research, the issues of validation and using big data to really figure out the cutoffs. But then at some point, states have to kind of make it their own as well. And so it's great that we have Kate Sandel to talk with us about the way in which Massachusetts has gone about this, because they've worked closely with AIR to really develop a system, and I think it's pretty comprehensive. And what I also like about it is how accessible it is. As you said, the schools have to have this information, but the system that you've created is really designed to help schools identify who those students are and what some of the dimensions might be. So, Kate, can you give us kind of a run through then of how is Massachusetts approaching this whole early warning system?
Sure. So in Massachusetts, we have our early warning indicator system, or EWIS, and as mentioned, we worked really closely with AIR in developing this system. And before building out this whole system, we did have a precursor, this indicator for rising ninth graders and looking at whether or not they were on or off track for graduating high school. And folks who used it in the field said, this is a great piece of information. However, sometimes our ninth graders are so far off track, it would be great if we knew about them earlier. And then other folks said, that's great to have that piece of information for that group. However, I'd love to know about how my kids are doing as they enter 10th, 11th, and 12th grade. So there was a little bit of an interest in expanding this one indicator into more of a system. So with support from a state longitudinal data system grant, we developed it to identify students in grades 1 through 12 as high, moderate, or low risk of missing key academic milestones. And the important note is we're saying they're at risk without intervention, because as Susan was talking, the whole goal of having these warning systems is to take action and hopefully get students back on track. The work to develop this system, we really started around 2011 and worked closely with Susan and AIR to really develop and design this system. And it took about a year and a half. Like Susan had those steps to do it and to really do the research and identify the indicators and validate them and do some of the initial reports and tools for it and implement it. Took a little bit of time, and our first release was for that 2012-2013 school year. And so this last fall we've just done our 5th release of EWIS data. And We release it, we provide these risk levels at the beginning of each school year, because the state level, we're able to provide a transitional indicator, or that incoming indicator that Susan mentioned. And we provide this information to school and district personnel through Edwin Analytics, which is our secure portal. Access is determined at the local school and district level of who gets access to it. And there are student level reports, and there are aggregate level reports. And we've developed a couple of reports based on feedback from the field, and we plan to develop some more in the future for what types of reports and information is most helpful. And a big thing is this EWIS data is not publicly available, and I think that's, again, hitting home. This is not about accountability. This is not about labeling the students. This is about providing information to educators to get students back on track. And
can you pause with that for a little bit?
Yeah.
So I know there were some questions that came in were specifically about that as well. Concerned that as we start looking at early warning indicator data and we're trying to get that information out, how is this information secured, and who does have access to being able to look at which students would fall in this early warning category?
So our Edwin Analytics is the secure portal, and that's where, you know, schools and districts are able to log on and get the state assessment data. And so it's similar security level to that, where it's determined at the local level. We do have reports teachers can see sort of the risk levels of their students. We can also, guidance counselors can get access to their students in terms of some of that student level information. I think the big thing is this is not for a school to have it on the public report card of what percentage of students are at risk. This is for educators to get access to it. So it's in the same portal as our assessment data and sort of treated with the same level of security.
So just to review then, so the teacher has access just to the students they're working with. School counselors have a bit of a larger pool because they're working with a larger group of students.
And really, actually, it depends on the school level. Teachers could have access if that school and district has given the teachers access to this type of data.
But they're not getting access to every student, just their own particular group.
No, I mean, no, they shouldn't. Typically, they only have access to their students.
Great. Okay, I just wanted to make sure we covered through that. This is a pretty secure system.
I mean, we definitely report it's definitely a secure system, and we're really careful about how, in general, EWIS data is used and viewed, and so that it's used appropriately. Like, we've provided guidance through the educator evaluation to say, you know, teachers shouldn't be graded on whether or not their students go from high risk to moderate risk, because that's not an appropriate use. It's not an accountability measure. However, you could set a goal around data usage and using the data to inform their practice, that's an appropriate use of the data versus an inappropriate use.
Great.
Yeah. And I think Susan hit home of the importance of using local data throughout the year. And so while we have this transitional indicator of risk, we also want to frame EWIS implementation as the use of this information, and so that's using additional information, which can be other state sources of data, but also a lot of locally held data, some qualitative information that you have, to study the student's risk, explore those underlying causes, and then to deploy, program, and monitor students. And I'll talk a little bit more about that implementation. Oopsies. Sorry, back one.
There you go.
And so just a little bit more about the concepts. We take everything we know about the student from the prior school year and provide a risk level for the next year. So, you know, I took information that's all in the existing statewide collections. So this is things like attendance. We also have suspension information. We have course performance. We have state assessment data. For some of our, we have if there are ELL students, their ELL proficiency. And then we also sort of brought in some additional information for some post-secondary work around SAT if they took the SAT, and if they took some AP coursework. So we've started to expand it. But we're only using existing statewide data collections to get at this information. And really part of it is we get so much information, and as a state, this is an opportunity for us to take that wealth of information and turn it around and provide a useful tool, hopefully, back to the field to better serve students. But it's a statistical model that we run. We don't just have flags set up for each of the things. So it's not, the risk levels aren't based on a student's relative risk compared to other students in their school. It's looking historically at students who were similar to them in the state and how they ended up doing. So some school might have more students who are high risk than another school. One school might have very few high risk students. So it's not the relative risk of students sitting next to them in the classroom. And it's a statistical model, so the individual indicators aren't necessarily, you don't really want to break it apart and say this student became high risk because of attendance. That might not be readily available of what's the one thing that pushed the student over. That's sort of typically the question. People want to break apart the model and say what's the one thing. And that can be very difficult. And so we really try to encourage folks it's taking all the data points together, and we sort of run the statistical regression model, and it collectively forms the risk level. And that, again, this is a starting out point of where we're flagging students. And so there's the additional diagnostic work that sort of has to be done on the ground. And for our risk level, what we see is, yeah. Go ahead, Scott.
I was going to say, use the word diagnostic, but it's not so much that it's a diagnosis. It's sort of, we need to do additional work to figure out what might be going on for that particular student. It could be not a diagnostic like a mental health issue. It could be that they've moved or that they've had some major life stress that's occurred. So there has to be that kind of follow-up to really understand the nature of why their attendance changes may have occurred.
Exactly. And so it's very much, it's not a diagnostic, that the additional, exploring the underlying causes and seeing why a student is high risk, because it's also, you might be able to look and say attendance was a big issue. The student missed a lot of school last year, but the why that student missed a lot of school isn't going to pop up without that additional information that's likely held locally. Was it a medical thing? Was it moving? Is there housing instability, and so the student, is in and out of homelessness? Is it, did they just take a trip and they're actually fine and on track, but they missed 2 months because, the parents had an opportunity to go abroad or something? So we don't quite know what it is. That sort of requires the additional work. This is just the first step, this EWIS risk level. And when we say a student is high risk based on historical information, they're really at risk of not reaching the upcoming academic milestone. And we know fewer than 25% of those students meet the next milestone. So 3 out of 4 are missing it. And our moderate risk students, it's around 60% end up meeting the outcome, and in low risk, over 90% of those students meet the milestone. And I've mentioned the milestones, and this is very similar. Again, of course, we worked with AIR in developing this, and it was really important for this to be meaningful to the field, and so we've split up and created some grade level groupings, and the milestones are tied to that. So for students who are in grades 1 through 3, we provide a risk level that's tied to reading by the end of 3rd grade. And for students in 4 through 6, we look at whether they're middle school ready, and our proxy for that is reaching proficiency or higher on the 6th grade ELA and math state assessments. And then for students who are entering grades 7 through 9, we say, are they likely to be high school ready? And that's passing all grade 9 courses. And then for students in grades 10 through 12, they get a K-12 milestone, which is this high school graduation, and are they likely to graduate high school on time? And for these first four academic milestones, these are the ones that we've provided risk information since that 2012-2013 school year. New for this year are some post-secondary milestones, and we were able to expand our EWIS system to include this post-secondary work thanks to a new state longitudinal data system grant that we got. So not only are we looking at this post-secondary, we also have been able to bring on an EWIS implementation specialist to really help schools and districts dig into not only the post-secondary data, but EWIS as a whole. And for students in grades 10 through 12, they now not only get a risk level for high school graduation, but also these post-secondary milestones. And so we got information leveraging National Student Clearinghouse information and also our partners at the Department of Higher Ed to be able to predict enrolling in post-secondary education, post-secondary academic readiness, which is enrolling in credit-bearing courses without developmental education, and then also college persistence, so persisting to the second year. And those last three, of course, they're new for this year. We right now only have one report tied to that. It's a student-level report. But similar to what we've done in the past, we're sort of waiting to see how folks are using this data and what additional reports or tools would be helpful to have in Edwin Analytics for us to design those reports to help them.
So, Kate, we're going to need to move on to Maureen in just a second, but before we do, can you just explain what the state results, what that data means?
So one of the important things is while each of these is just showing, as you can, the percentage of students who meet the different academic milestones, and they're not all the same, but we know these build on each other. But so that's an important thing. So if there are fewer students who are meeting the academic milestone of middle school ready, chances are we're going to have more students who are identified as high risk.
Okay.
In those groupings. So that's an important thing for folks to use. I guess before we move on, I will just sort of show one of the key things when we do a lot of trainings, webinars, day-long trainings, meetings at convenings, and one of the key things is for us to really highlight what it is and isn't. And I think this echoes a lot of what sort of Susan has said, but it's really about targeting interventions and not being a label. It's a flag for the students. It's not a diagnostic tool with why it is. And while it's related to accountability, it's really important that it not be viewed as accountability. This is optional. This is just supposed to be helpful for folks in the field. And we examine it continually. And so that it's not stagnant. We have to adapt as data changes, and we were just able to expand it with support. And then it's also really helpful to use with additional data throughout the year. And then a final thing is we adapted the cycle, and we've developed a guide. We did a pilot with AI worked with us, and we did a pilot with 9 districts and created an implementation guide. And based on feedback from the field, sort of adapted the cycle that Susan showed earlier. And one of the key things is the idea of this exploring underlying causes, taking action and assigning interventions, and then monitoring is repeated throughout the year. That sort of was feedback from the field of, we really want to highlight that this is an ongoing process that people engage in. Great.
Okay. Well, thank you.
Thank you.
So I want to encourage everyone to write some questions down in the boxes. In your chat box so that we can respond, especially if there's questions for clarification. We've just went through a huge doctoral dissertation on the research, and now we're going through a whole implementation study that's actually quite complex as a state. So I'm sure there's a few questions that may have come up, and please put them in the boxes. If we can't get to those, we will get the answers to you and get them sent back out. So, but now it's a pleasure to introduce Maureen Binienda, and I may have mispronounced that, but I apologize, Superintendent at Worcester Public Schools. So now we'd love to hear from you, Maureen, about how is this working, on the ground in terms of a district and in the schools that you're working with. How are you using it, and what's your experience so far?
Oh, can you hear us now?
Yes.
Oh, perfect. I also have Dave Purda here with me. I'm actually coming from the point of being a secondary school principal and really using this system to try to reduce dropouts, but also to look at the at-risk of the students. And I've appreciated actually having this tool so that although you look at your data, your other data, through the secure portal, and you look at your attendance, your dropouts, your graduation rate. It is really good to have another document in case you may have missed something to look at that looks at all the indicators, so that you can, with a team of people actually in each school actually go through and decide which students are really at risk, so that not all the students that are on that list were actually at risk, but it might identify them, for example, attendance, but that student had a medical issue and they were out. but their number of days would at least alert you to the fact that you need to look at that student. So through Edwin, it allows our administrators, to easily identify the students at risk, and we combine it with the formative assessments, with also classroom observations, and we try to look at what are the causes of it, and then the educators, might be the focus instructional coach, the ILT team, and the principal really then try to do intervention strategies for the high-risk students.
Great.
Right. So it's kind of like it's a six-step process. We get the data beginning of the school year. We also add our own local data because we do a lot of formative assessments and summative assessments. We look at the relationship between what we're given. A lot of it has to do with the attendance, discipline, the test scores, and then we plan our action. And then we do the monitoring of the students and the interventions, and constantly going back and looking at that list, because as you can imagine, kids drop off that list, the interventions are working, and then there are new students that add on. So following that list, each teacher also provides a red, yellow, green list for every student that is in their classroom, so they're constantly monitoring that list also. So it's very advantageous because it gives us a starting point, and then from there, the interventions can be individualized to each of the needs of the students within each of the schools. It also is a great training for staff to be able to have all that information at the beginning of the school year so that they can already start to decide in planning their lessons, so for example, you might have a lot of kids that are identified at risk, but they could be your ELL students that are 1 and 2, and so therefore their MCAT scores may not reflect some of their needs, but also there could be false negatives there because it's just they haven't learned the language. So then that would be a clue to the teacher. They really have to think about what SEI techniques to use in the classroom to provide the extra support that the kids need. So it's really a great tool for identifying the needs within the school. So there can be, individual needs interventions. We also have graduation improvement teams that come off of that. So what targeted interventions do we need for students to be able to graduate? Like there's certain extra courses they need to take. They need to do after-school support. That all comes from looking at the EWIS.
Great.
Also, with Public Schools College and Career Readiness Network, we also have 22 community-based organizations, and some of their focus is on helping at-risk students. So that allows us to also look into what other supporting services that are outside the school, but are partners with the school we can bring in for students to be successful. We do some data sharing, but of course it's all vetted through Dave Purta's office here, so that we make sure that we're following, FERPA compliance on that. Some of the external programs, they're one-on-one sometimes to, work with students. We also have some programs that are the TRIO programs that come through with like the Talent Search, Gear Up programs that also we use to target the students that are on that list that need the additional, especially around the career and college component part of it. It allows us to not duplicate our efforts, but to make sure that there's a service for all kids. And
great.
That's pretty much our slides on that. It's a great tool, appreciative of the fact that it is on the secure portal. And I know you had a question about do all teachers have access to that, and we don't have that. Not sure if it's a teacher tool that at this point they need access to. Usually it's through the principal, the ILT team that then provide the data to all students. And we also provide, we call it transition report to all staff that tells we add the grades from the year before, the access level of the student, so that in combination with that report, teachers have a really good idea of who they have in their class, and they, again, can do their own at-risk levels for those kids.
Okay. Well, let me bring Dave Purda in then for a quick question that follows up from what you just said. So Dave, you're the big data guy as well in the district, and so how can you just kind of walk us through, like if you're working with a high school or a middle school or elementary, whichever level, how does this data, how do you actually do this? You know, so who collects the data? How does the discussion occur? And can you just walk us through what it would look like at the school level?
Yeah, thanks, Scott. I appreciate the question. I think it's just a really good time of year to be having this conversation and to be having this webinar. You know, here in Massachusetts, you know, we just this past what was it, Monday, released the MCAS and the PARCC scores and all the state accountability data, right? So everyone's sort of clamoring about, sort of trying to see what level they're at and what the aggregate data tells us about schools. But here in the district and in the Worcester Public Schools, what we're really trying to encourage schools to do is to take that aggregate data that we get from you know, from the accountability system and start to zero in to the individual level to develop those interventions that we've been talking about on this call that are specific to either groups of kids or to individuals. So we've been making great use of the EWIS system in Massachusetts for a long time. We're really excited about some of the new things that have come down the pike in the last few years at the earlier grade levels, and now we have this stuff that allows us to look at the post-secondary area as well. And you know, while those kids are in the Worcester Public Schools, to what extent can we put things in place that are going to help them achieve those goals that those milestones that will take place after kids leave. So one of the things that we really try to do here in Worcester is I think one of the significant limitations of the EWIS system is that it's based, you know, solely on data that school districts submit to the State Department of Education. So one of the benefits of working in a school district as compared to the state is that we have access to a lot more fine-grained information here in the district that does not get reported to the state. So we try to make sure that our school staff are keeping that in mind when they're examining the EWIS data. And to Maureen's point, to try to stay current with data that is more recent than what is coming through the EWIS system, such as our formative assessment data, such as attendance data, you know, that is, you know, in real time, you know, from September and October as opposed to last year. So
well,
we're working with schools and really get them to move from the aggregate data to making lists of kids, coding them up as red, yellow, and green, and making sure that there's interventions that are likely to impact the success of kids.
That's awesome. Thank you. We've got about 20 minutes, and I'm going to start with some questions that have come in and some that have come up as we're talking. So if you have some questions that you specifically would like us to address, please put those in the chat box. I'll be working with on this end of it, and Livonia will be tracking those and jumping in as the questions seem particularly relevant to the conversation. The first question I wanted to get to, and I put the academic milestones up because I think this is pretty critical. Susan, you mentioned it as well. You kind of talked about this thing called milestones, and this just seems like this is the most critical part of the whole process because you're kind of focusing and honing in on specific areas. And one of the questions came in, and I was hoping you might be able to give us some more detail. How are you using the MCAS to determine this kind of at-risk quality? And you're focusing specifically on third grade ELA. Can you explain that a little bit? Like, what is there a cutoff? Is there a particular, is it the severity? How are we using that MCAS, or even now as we're moving into PARCC and whatnot, how are we using that to determine that a particular child is in an at-risk category?
So, all right, you directed it to me. This is Susan, but Kate, you could also chime in.
Yeah.
So, So when we were thinking about reading by the end of third grade, for example, we needed some sort of measure that's available for all students for most students, or majority, across the Commonwealth. So you really need to hone in on an outcome that is measurable throughout Massachusetts in this particular instance. And so we chose to use proficiency or higher on third grade ELA, the third grade ELA state assessment as a proximal measure for reading by the end of third grade. So that, you have to define your outcome clearly and have a clear measure in order to kind of determine who's on or off track, or in this case of high, moderate, or low risk of missing this outcome. And so that's one of the decisions we had to make. And it's actually one of the challenging parts of it, because you do have to, there's outcomes that we know are important, but if you don't have consistent measures, especially at the state level, then you can't look at that outcome.
So one of the things you said was critical to the system, and you mentioned it around social emotional learning is one of the potential drawbacks, is that you've got to validate it. So how did you validate that the third, that proficiency of the third grade was that risk factor? And is there are you able to share with us a sense of just how predictive that is of dropping out of school?
So we made the assumption that the third grade ELA state assessment proficiency on the ELA state assessment was meeting the milestone of being able to read by the end of third grade. We used proficiency or higher or not proficient to validate the actual indicators. So to come up with this a little bit of a complicated kind of roll-up of information to say, the students at high, moderate, or low risk. Does that make sense? So we know that we looked into the research and we saw that reading by the end of third grade is a very important outcome for later success, and so that's widely accepted. And then we identified a measure that was a reasonable proximal measure for reading by the end of third grade, and then we stuck with that outcome and tested indicators against that. We didn't validate the indicator itself. We used research to inform the choice of the outcome.
And I'll just tack on, I think we were really we were limited in what is available in our state data, and we were wanting things that were meaningful for a particular age, for the age range and for the educators working with those students. We have continued to look at these, and we know they build on each other. Like, not only do we know that from the research, but we have done the additional work sort of here within the state to see it. And so, like the research says, students who are proficient or higher on the third grade, historically it's the third grade MCAS, they are 4 times more likely to graduate high school. And middle school ready, it's the same, it's a little bit higher. And then for students who pass all grade 9 courses, those students are like 14 times more likely to graduate high school on time. So we do know that they build on each other. We didn't necessarily do all of that legwork before we selected them. We selected them based on the research and based on the available data and decision making, but we have done that validation and we know they build on each other.
Okay, but we don't have like a cutoff score on the MCAS to know, this person,
well, it is. There's a proficiency cutoff.
Right, but it's not, but you haven't validated.
Yeah,
right.
That has a score associated with it.
No, I understand that. I'm just saying that when we started the conversation, one of the critical things that was brought out is the need to have these cutoff scores so that we can know for sure. But what you're saying is that you're using proficiency as that proxy for that cutoff.
Yeah.
The cutoff score.
Okay.
Susan, I think you also were talking about the cutoff scores for the monitoring thresholds.
Yeah. So the cutoff scores, there's a little confusion there. So in this instance, proficiency or higher on ELA, ELA, MCAS, mathematics, I don't know why I'm saying that, is the outcome. But there are other types of indicators, for example, attendance, that you can use a binary type of, yes, we call it a cutoff threshold, So kids who miss, based on Consortium for Chicago School Research, kids who miss 10% or more of school days as early as the first 20 days in grade 9 are significantly less likely to graduate from high school on time. So if you look at that, the cutoff point then is 10% of school days. So within the first 20 days, that would be missing 2 or more school days, for example. So that's what I meant by cutoff threshold. In this instance, when we talk about ELA, the reading by the end of third grade proximal outcome, that is a predetermined outcome. We're not changing or looking at those scaled scores or any of that. We're just looking at the state determination of proficiency.
Got it. That's what I just wanted to clarify. Good. So, Kate, I had a feeling this was going to be a complicated issue, and I'm not sure I understand it exactly either. But can you go back through this state results column and explain what that means? It's hard to understand. Another question was, are they based on the same N value? Was it the same size samples? I'm not sure about that either, but Megan was had some questions on that. But maybe you could just go walk through that again.
Sure. And so we include them because this is just saying, so for the and this isn't reflecting the 2016 school year, but in 2015, 60% of third graders in the state were proficient or higher on the third grade ELA. So that's just the result. So there are different ends because it's saying from the 2015 school year and how many students met that milestone, and the same for middle school ready. So 55% of sixth graders were proficient on higher on both the ELA and the math state assessment. And then for our ninth graders in 2015, 79% of them passed grade 9 courses. And it's important, sometimes it's helpful to include that because if I'm an elementary school and I actually have, in my district, students do really well on the third grade MCAS score, but they don't do as well on the sixth grade MCAS or the state assessments, you might see an uptick in the number of moderate and high risk in fourth grade, and you start to worry about, oh, something's going wrong with, the third grade teachers or the fourth grade teachers or the fifth grade teachers. But it's a different milestone, and so there's a different percentage of students who are meeting it. So one of the helpful things as people dig in is to see how they're doing at the school or district level on these milestones. And most all of these results are publicly available. You can go to profiles and see how you're doing on the state assessments. We have something called a Success After High School DART, which is our district analysis review tools, and they're Excel-based, and you can go in and you can see how your students are doing on passing grade 9 courses, high school graduation, college enrollment, academic readiness, and college persistence. So seeing how you're doing on these milestones is helpful.
Right. That's great. And I think before we get over it, I want to get back to Maureen and Dave in a second here, but the DART data is great also because you can disaggregate to make sure you're having the same impact with different groups of students. So I think thank you for bringing that in. That's a very powerful resource. What I want to do is I want to switch. We've got about 10 minutes left. I want to switch the conversation back to where a lot of the questions were. And it really had to do with that number 5 area, right? So design a program to support that student. And it seems like and I know, Dave, you talked about, you and Maureen were talking about there's other data we use to kind of understand it. But I want to focus, and I just want to throw in one bit of piece because we kind of started with it earlier and it was a theme, was social emotional learning. And you have on here an article that's actually, I think, addresses exactly what Susan talked about, that in order for social emotional learning to be something we can use in an early warning system, you've got to have a long-term prediction. It's got to basically predict them from a certain period of time to see through time how they predict. And this is an actual study that has the cutoffs showing that middle school social emotional learning is highly predictive of later dropout. But what was interesting, and this is one of the things I wanted to ask you, Dave, about, and Maureen, is it seems like with social emotional learning, at least the research and also the kind of clinical case studies and practice, is that the early warning indicators that we're looking at here, these milestones, are sort of the lagging indicators. It's sort of like, okay, they've demonstrated that there's a risk going on. They've demonstrated the low attendance. They've demonstrated. But it seems like with the social emotional learning, and from what I'm hearing, it may be the leading indicator that I've had a number of cases where based on social emotional learning, they find out that their top students have been, in one case just recently, the principal came up and said, thank you for working on this because now we found out our leading student just tried to commit suicide. Or in other cases, they find out that their valedictorians are homeless, that there might be some other elements to life that's going on that may not be in that formative assessment that you were talking about, Maureen. It may not be in the other data, Dave, that you're talking about, but may actually be something that's around the personal component of this that may be important when we start to think about designing interventions. Could be stress and health issues, could be other life things. So I'm just curious, Maureen and Dave, how is that kind of stuff, maybe not as a complete assessment, but how are you bringing that in? You've already mentioned I think that in your intervention you need community-based organizations, for example, because you don't have enough school counselors within the district to really provide that individualized support. So without that, how does that information get in, or is it that a challenge so far?
Well, it's really interesting because we just restructured. We now have a manager that is going to be in charge of social emotional learning in Worcester, which will oversee, your school psychologist, your staff. But our focus even more on that is because, like you say, the situational crises that already occur. Academically, you look at the student's profile, they come to school every day, they're getting good grades, there actually are, no precursors that child is going to all suddenly be at risk. So the answer to that is certainly in the training of staff to start to identify signs in the classroom, subtle signs that a student is starting to have some challenges, and to right away go into Tier 1 intervention so you don't have to jump to the 2 or 3. And so it has a lot to do with the training and observation of teachers, and it really lies in those personal connections that staff have with kids every day. So that's where we're actually working on, what are the interventions that all teachers can do in a classroom so that, not based on, a lot of the attendance, although that would be something that could crop up with somebody that previously didn't have that problem, is for teachers to become more aware of what to observe in students, right? But also in their classrooms of even their methods of instructing students. Really work around, not total teacher interaction all the time, teacher direction or instruction, but really that gradual release so you can start to observe if there are some things happening in classrooms. So, that's such a big area right now, but it's especially in, gateway cities where we are having such a very large increase of students, refugee students right now. Worcester just got 73 refugee students from various countries in the area of trauma, and those students are not identified yet because they have not had any testing, right? They don't have a history of attendance issues. They have a whole new group of challenges. So I think what we're trying to do is to develop awareness in teachers and in all staff of what to look for that is a sign of trauma. So that's a brand new area for us, and really this work that we're really digging into because we already have the trauma and we already have the students that are struggling. So Worcester has this group, it's called the HEARS Project in one section of the city right now, and we're training staff. Instead of changing kids, we're training staff to have their teaching methods and their awareness and their observation, their skills, sharpening them so that they can be the people that identify what's happening in the classroom. So although that's not a written report, that's definitely observation and interactive with the kids that are in front of them.
So it's Scott, really interesting as you talk.
Can I just
go ahead.
That's a really good example of how these data are used, right? So it sounds like they identified kids who are at risk. They went further, diagnosed some of the needs, noted that there were some need for social emotional learning, and applied that universally so that all teachers are trained in providing this type of support to students and recognizing needs in students. And so that's a great example of how a risk factor led to further diagnosis and then a universal intervention. And, you know, not all schools, and it's a great example of how you start to customize the supports available to schools at the universal, targeted, and intensive types of supports based on the students before you. I think that's a great example. So the students had a strong need. It was widely needed more broadly, and so that became a universal support. And then a targeted support might be, you know, something else. But a universal support in one school may just be a targeted support in another. So that's a really great example of how using these data can really change the way schools are kind of customizing what they're offering to the students that are in their school. Yeah. So that's laudable. Good job.
Great. Okay. Yeah, it also sounded, I was also hearing that you're also in a prevent. So before that data comes in, you're already working with refugee students coming in before they show up on the early warning indicators as well. So a nice example of knowing that things are based on this data you've had in the past, knowing that these things are going to show up if we don't start working now, which is great too. Yeah. That whole idea of mobilizing is really critical. I have one more question, and I'm almost out of time, unfortunately. I was hoping to get to it earlier. This was from Fred, and it's really, I think, Maureen and Dave, what do you do when students they're not meeting the milestones, and year after year they're not meeting them? Are we holding them back? Is there consideration of what we're trying to do? How do you further personalize the learning experience for those students? Maybe can you just give us a bit of an idea about that? So these are the ones that we're trying, but it's just not working.
So in Worcester, we have some regular ed alternative programs that so students that, you know, the comprehensive high school is either too big for them or doesn't meet their needs, and those programs, students have smaller classrooms, but they have access to different technology. So we use the Play-Doh platform technology for students to do some interactive work on there. You can use the VHS work for that. We're right now writing a grant in conjunction with the governor's office to expand for those kids the vocational high school to open up opportunities so that they're actually be trained. So, for example, in Worcester, there's a great need for people to go into the manufacturing business. We have old-time factories that all their people are going to be retiring, and there's been no push for employees there's been no push or no availability of employees to take their place. So it's going to be a critical shortage. So we're taking those students who in the past have not been very interested in the academic life of their school, no matter what type of support we provide. So they are going to have that opportunity to go to the vocational school, get trained in manufacturing, and now they're going to be able to get internships and jobs. So we're looking into whatever means, well, we're starting a new type of program, obviously. We're using our resources better than we did in the past, extending the vocational school into a night program also for the older group of ELL students that have come into the country who probably won't be able to access the full high school diploma because of their age of entry, 19, 20. But we put them then through the adult ed program and then on to the jobs also. So we're trying to, we don't want them to be dropouts. We have a group of students who just aren't interested in the academic. They don't want to go on to college, but they would like to get some training. So we're providing them a way to catch up and still meet the Common Core and still meet the high school requirements. But that missing piece for us, truthfully, has been what happens after they get that diploma. And it has been the training into the workforce. So Workforce Central, the Chamber of Commerce, and the Governor's Office is providing us a grant, and we're exploring that this year on how to provide that missing piece.
That's awesome. So basically, what I'm hearing you say is it's not a question of holding kids back. What we're doing is we're putting them into a more intensive, more supportive, more personalized learning environment, and in many cases there may be also a more school to work type environment that's going to help them, gain the kinds of skill sets they need to enter the world of work.
And I think that's it for them, something smaller, personalized, a little bit quicker, because what happens is they get they're too old, and then they lose their motivation to get that high school diploma, and so the need is really to provide them support, help them get through that part of it, and connect them to something that's going to give them a good salary.
Great. So we're right at the close of the hour, and I wanted to thank Susan and Kate for the efforts that they're doing at the state level. This is a Herculean effort to have this kind of data available to schools where we really can isolate, figure out which students we need to put these limited resources towards, where we can bring community-based organizations to really provide support. And we're not spinning our wheels, and we can really find those personalized interventions when youth become at risk. And these milestones are a great way to organize that information. And what I really like hearing in terms of Maureen and Dave is you're really saying, but this is only a starting point. That gives us one bit of information, and it certainly allows us to identify a group. But then we got to go deeper. We've got to bring in our other data, and it just like sparks a whole support effort that we haven't had in the past because we just didn't know who we should be focused on. So it's very exciting, and I want to thank you all for your participation. And if you have other questions from the people that were listening, please send them in. But thank you very much for listening. Livonia, did you want to add anything at the end here?
I just wanted to extend my gratitude to our speakers and to our participants for joining us today, and also highlight that in addition, there is another file entitled Meeting the Challenge, which also gives school-based examples of how to use early warning systems, again, situated in Massachusetts. So we encourage you to look at those files as well as use the resources embedded within this presentation, and send us any questions that you have in the future. Thank you for joining us.
Thank you for inviting us.
And we look forward